Awesome. All right. Well, thank you everyone for joining us today. My name is Maura McGowan. I am the program director of the New Hampshire Teen Institute.
And I'm Marissa Carlson, and I have the pleasure of being the executive director and getting to work closely with Maura.
And we wanted to spend some time today talking about how to foster and maintain emotional health. One of the reasons why we chose this topic to focus on over the last couple of years is because of everything that we've all been experiencing through the pandemic and shifting our lives in ways that we haven't had to before. And in the work that we do with youth and with adult volunteers, we find that, really delving in a little deeper than just your basic self-care kind of conversation is really important in getting through these stressful times. So that's what our goal is today, to talk a little bit more in depth about emotional health and how to take care of ourselves, and to also help those within our lives. So whether it's those we work with, those we provide services for, the people that we live with and share our existence with, really being able to help people through all of the different things that we deal with on a regular basis. So before we get into the workshop itself, we of course want to go over just some basic group norms and some Zoom etiquette, which I'm sure everyone is pretty used to now, but it's always good to go through. So we always ask that people be open to new ideas, to listen without judgment, to both take up some space, but also make space for people to be able to share. And we always ask that in any group we're in, people might share some more intimate things about themselves. So we want you to take the message, but always leave the story, especially in a place like New Hampshire, where it's a very small community, making sure that we keep people's confidentiality intact, but take those messages of what people have shared with you. We ask that people display as best they can their name and their pronouns so that we can refer to people the way that they would like. Video encouraged but not required. We know everybody's sitting in different spaces than we normally do. So if video is not workable for you, that's totally fine. But if you can, we do like to see faces. And keep your Zoom muted unless you're sharing, and you can also share through the chat, of course. Use the hand raise as a way to share. All of those different options for sharing with us today. But just to keep it easy for everyone to hear, stay muted as much as possible. Right. Any questions or anything we missed in those group norms and etiquettes that would be important for anyone's comfort? Awesome. All right. So we are going to start with a definition of emotional health. So emotional health really is all about how we think, how we feel, and how we behave. So it's this combination of things. It's about our ability to monitor and adjust our thoughts and feelings and behaviors as they're happening. But it's also about understanding the signs that we need to be aware of in order to do that adjustment during those stressful times. And it's about being aware enough of yourself and sometimes others too, to manage those changes before or as they're happening so that we don't get overwhelmed by our thoughts and feelings and behaviors.
So in thinking about emotional health, and I think, as we know that people are coming from different sectors, coming from different fields and different ways that you interact with the community. Why do we feel that emotional health is important, like good emotional health and wellness? And you can kind of answer, you can answer in the chat or unmuting. You can answer for yourself or answer for the folks that you work with. thinking about why it might be important to have
Oh.
it. Yeah, go ahead, Beth.
Well, I think it's about being able to do your job and being respectful to the people around you. If you're constantly going off or triggered, then you're not going to be effective, and you're not going to be, nobody's going to want to sit next to you at lunch, you know?
Yeah, absolutely. Yeah, so that gets a kind of like, it's important for yourself, but it's also, it impacts everyone around us, right? Like when especially in the workplace and as we're doing more things kind of with each other. Yeah, and as Joe said, I mean, it really impacts everything we do, right? It's impacting things at home, it's impacting things at work, it's impacting, you know, things with family and friends. Yeah, and Michelle said, you know, that it's such a core piece of a healthy life, you know, so it's not, sometimes we neglect that, right? Sometimes we think a little bit more about, you know, some of the physical health things, especially, you know, as we've been going through, you know, the past 2 years. Obviously there's a huge focus on like physical health and wellness, and sometimes, you know, it's been hard to kind of take that time or be able to reprioritize and make some of that space for taking care of our emotional health and wellness as well, because we're all being pulled, as Maura said, in these very different directions. And you know, it's kind of this constant retooling of how we're doing work and where we're doing it and how we're interacting with family and friends. And Debbie, yeah, absolutely, kindness goes a long way, right? Like kindness towards others and also kindness towards ourselves, right? I think sometimes we, especially if you are, you know, I know a lot of people here are in different kinds of helping professions, right? So, you know, behavioral health, other aspects of public health and wellness, you know, we have educators, you know, things like that. Sometimes we're good at being kind to others and not always good at being kind to ourselves, and thinking about that kind of self-awareness and those things that we need as well, and giving ourselves that positive self-talk as we go through our days. Anything else? Any other reasons why emotional health is important?
To prevent burnout and, you know, just fatigue from your work.
Yeah, absolutely. You know, any of these, you know, the helping professions that we're in, for the most part, like as we, you know, as we're kind of looking at human services and public service, right? We know that there can be really high levels of burnout, and part of that can be sort of not tending to that healthcare for ourselves emotionally, and not really kind of always having a chance to be in touch with the changes that we see in ourselves. We're going to do an activity in a little bit that's going to look at sort of how do we see when things might be changing, and how do we not wait till things are at like alarm bell level for ourselves. And so, and that is so important, because we don't want to wait till we're feeling completely burnt out, right? We want to try and see what we can do before that time hits. Yeah, so and yeah, helps you feel a measure of control. Thank you, Maura. You know, we want to make sure that we're feeling in control of the things that we can feel in control of, right? And sometimes there's a lot of unknowns. Certainly, we've all been dealing with lots of unknowns as we've been going through the last, you know, the last couple of years, and certainly before that as well, right? So there's always unknowns when we're working with the public, maybe we're working with students or young people, or constituents, right? There's always going to be some unknowns that are coming at us. And so feeling in control about the things you can control is such an important piece of emotional wellness, and one of the benefits. It affects other people and the way they interact with us, right? Yes, Joe, absolutely. You know, there's such a, you know, everything as we go through, you know, various trainings, I think we often hear that, you know, putting on your own oxygen mask before helping others, right? So like, we're going to have better interactions with others when we're kind of tending to our own emotional health. I think it helps us utilize our resources better, maybe more effectively. So utilizing, maybe it's formal resources, you know, maybe it's utilizing, you know, like formal supports in our communities, whether it's, you know, community services or therapeutic services or things like that, or it just kind of helps us, you know, utilize, maybe we only have half an hour with a friend to kind of, you know, get a chance to catch up with them. And I think when we're feeling like we're tending to our emotional health care, then we're sort of more able to be present in the ways that we interact with other people, and really kind of maximize maybe the limited time that we have to catch up with folks that we care about. And obviously, you know, as we had said, and as Michelle had brought up, it's not that emotional health and physical health are completely separate, right? We know that there are those links there. We know that when we're feeling good emotionally, it's easier to take better care of our health physically as well. So that's also really important. We're obviously talking about emotional health here for this hour that we have, but it's not exclusive from physical health. So I kind of threw out a little bit of a spoiler there with that. I want to throw it back to Maura to talk about a really great activity that we'll try out, and then you can also use with folks that you work with.
Thank you. So as we were saying, the link between the physical and the emotional is definitely something that we know is there, and we can see a lot of times in ourselves and in others. So we created this grid as a way to really look at that and understand that a little differently than maybe we have before. So we have our physical signs, our emotional signs, and the things that other people would notice, which is really nice, again, to use if you do this activity with coworkers, or if you have those that you are providing services to can fill this out, or even those, again, in your family can fill this out and look at this. It really helps us to help one another. So the green section, those are when we are really in a good place. That is when our emotional health is in a good space. The yellow is that flag to us that things are maybe starting to move in a direction that isn't as healthy. And then the red is really that kind of danger zone when we are already in a bad emotional state, or in a less healthy emotional state. What I think we miss out on a lot, and what I have found I miss out on, or have missed out on a lot in myself and in others, is that typically we really focus when people are in the red. And that is never a place where people are as open to suggestions or to feedback, because they're already in that red danger zone. They're already in that place where everything's heightened and everything is harder to manage. And if we start to recognize those yellow, those like flagged areas a little bit more, we can put in interventions for ourselves or for others, or work with others to put in those interventions before they get to that danger zone, before they get to that kind of overwhelmed and more shut down to those suggestions kind of place. So I put together, this is just a simple one of mine, my examples for myself in where I noticed some things and where others would notice some things. So a physical sign for me, when I'm in a good emotional place, I fall asleep very, very easily. The second my head hits the pillow, I can just drift off to sleep. But when I am starting to feel some additional stress, or having a little bit more trouble dealing with my emotions or the things happening in my life, it takes me a little while to fall asleep. So, or I might wake up in the middle of the night and not be able to fall back asleep when I'm starting to feel some anxiety or some stress. And when I'm in that danger zone, I can't sleep. I can't fall asleep. I can't fall back asleep. I wake up very early in the morning and can't fall back asleep. My emotional sign is that I am able to handle frustrations in positive ways. So I know I'm frustrated, I feel my frustration, but I can handle it in a really positive way. Have an open conversation with the person or situation that is causing me some frustration, or behaviors that are happening that are bothersome, and I can have a really great conversation with others about that. When I'm in that kind of that transition into that unhealthy place, I start to just immediately blame other people without taking in a lot of other context and really thinking about what might be going on for everyone in the situation. And when I'm in that danger zone, I will just yell. I'm a yeller. I will yell frustratedly at people, at things. And I know that's when I'm in that bad space. And then what others would notice, a sign definitely that I'm having a hard time is when I'm in a good place, I will answer phone calls as they come in. I will also return phone calls very quickly. I don't love being on the phone, but when I'm in a good emotional place, I can handle being on the phone. When I start to move into that yellow space, I will send them to voicemail. I won't answer a phone call. I will make sure it goes to voicemail. I will check out that voicemail first before I return that call. And then when I'm in not such a great space, I will ignore calls completely and put them off as long as possible to return those calls. So again, by recognizing these places, I really can start to take notice, and others can start to take notice if I'm in this yellow space. So people I work with, like Marissa, definitely know my yellow places. My family knows my yellow places, so that if I'm starting to get into there, somebody can say, hey, what's going on? What are you experiencing? What are you dealing with right now? What are things that are causing you some anxiety that we can work on or that I can talk about? And then I less often get into these red spaces. So I haven't been in these red spaces in a bit of time because I've been working to recognize these yellow spaces and working with those who I spend a lot of time with to help me recognize when I'm in those yellow spaces, to get me back to the green, or at least not get to the red. We can't always get back to the green, but we can at least do a lot to not get into the red. So that's really the important part of recognizing those different areas, is those transitions. How do we get back to the green or not progress to the red when we are dealing with stressful situations? And we're going to talk about those ways in a little bit. What are those things that we can do? But before that, we'd really like for all of you to take some time to try out filling out sections of this grid for yourself, so that you can kind of see those areas and kind of get a feel for it, so that you can take this back again to the people that you work with, that you work for, and that you live with, so that you can kind of work on those recognitions of those yellow to red areas. So Marissa, how are we going to, do we have a breakout?
We're gonna be, we have one group of 4 and one group of 5. So we'll be in 2 breakout rooms. You'll have a chance to hopefully do some introductions, because obviously in this larger format, we didn't necessarily take time to do individual introductions. We'd love for you to introduce yourselves. And then you'll have a chance to work on, again, as Maura said, filling in the grid for a few minutes, probably I'd say about 10 minutes out of the breakout room time. And then Maura's going to pop a link in that's going to have some questions to kind of talk about after you've had a chance to work on it for a little bit. So you'll get a link to the like a copy of the grid, both a PDF and a document.
Yeah,
Maybe
I'll send just the
start.
Document for now.
Yeah.
Hold on, I'm getting that link into here. Okay, so this is the link to a fill-in document of that grid that we just showed you. And then I also have this activity sheet.
And while that's coming up, we know that maybe not everyone's in an environment where, you might be on a phone or an iPad or things like that. You can also jot down notes, the 3 categories, right? The kind of the green, yellow, red, and you'll have hopefully at least one person in your breakout room will be on a laptop or a desktop and can kind of access the files a little more fully. But you can absolutely take notes and, put it in later or kind of have that to refer back to.
So you all received a copy of this in the chat. So again, intros, take a few minutes, about 10 minutes to fill out your grids, and then take the remaining time to share about your grid, note some themes that you might see there, give feedback to one another on some things that that may come up for you, and talk about how you can utilize this in your work, and then be prepared to share that with the large group when you come back.
And obviously, you know, feel free to share whatever parts of it you feel comfortable with, right? This is, you don't have to like share the whole document with other people, but if there's just kind of themes to help talk about in your group, that would be awesome. Great.
I just cut in
Yeah.
really quick. In looking at the document, we need to request access to edit it.
Oh, sorry.
Huh.
Should have.
So what I did to kind of make it easier is you can just make it a copy of that document for everybody that doesn't have access. Just make a copy and you can edit it as a separate document.
Thank you. I will go into and change the access to it.
And making a copy is probably best anyway, because we don't, otherwise we might get people typing into the same thing.
Good point.
I just made a copy for myself, so I think everybody can do that. You know,
Great.
Perfect.
Thank
save
you.
some trouble.
Right. And message us from the rooms if you have any questions, we can pop in as well.
Yeah, awesome. All right, we'll open the rooms and we will stop by and make sure everyone has everything they need. Thank you so much. All right.
Let's get back to screen share.
Room 1 is
There
very
we go.
excited about their remaining seconds. They'll be back soon as well. All right. All right, I think everyone is back.
Awesome. Great. All right, so how was that overall? How was it filling out the grids for yourselves? We'll start there. Just take some feedback just on the personal side of filling out the grids.
Valuable.
Yeah?
Yeah.
Great, great.
Yeah, I actually made a copy because I'm going to send it to coworkers, and I think it'll be a really good activity to do at work for sure.
Yeah, that's awesome. That's awesome. So after you filled out the grids individually and you did some chatting, were there any themes that came up? Were there any things that helped in feedback or talking about the grids that you could share?
I think we really resonated that, you know, how the physical piece really aligns, you know, with our emotions. And we were talking about some healthy outlets to get ourselves to, you know, catch ourselves when we're in the yellow, how to keep us from getting to the red and, you know, getting us back into the green.
Yeah. Anyone else have any thoughts or feedback from your time?
I think in our group, we just talked about that. It was that during this pandemic, you know, for the last few years, so a lot more people, I think, have been spending more time in the red zone, in the yellow to red zone. I think it's just, you know, I exclaimed to my wife the other day after I got off the phone, waiting to make a simple appointment with a dentist for like the umpteenth time, trying to get through. They're short-staffed and you can never reach anyone. So you always have to leave a message and hope that they call you back, and they never do because the show. And I'm just saying, everything today is just so hard to do. Everything's different. Everything's difficult, you know, and it's just like, oh God, you know, it's just like, when's this going to, you know?
Yeah.
Yeah, it's just a lot. It's frustrating. You know, so.
Yeah, our frustration tolerances are at the breaking point. And when we're all living in that place more regularly, we really do have a lot less room for those little frustrations. Yeah. And we'll talk more. Oh, go ahead.
I was just going to say, and then, unfortunately, we hear in the news that there are people who don't handle it very well and they act out in very violent ways. So,
yeah. Thoughts as to how you can implement this in your lives. We heard sending it to coworkers. Can you see value in this in different areas of your life? And if so, which ones?
I think it's just a good reminder, a visual, just to kind of do a check-in and see where you are. I mean, I had talked about in the group, like throughout this pandemic, I've been kind of on that cusp between kind of green and yellow, but I try not to get into that red. I really, it's just trying, just on that cusp, and just, I think like I said, I think it's a good reminder just to, keep things in check and to check in with what, how you're doing.
Absolutely. While you were in the breakout room, we talked about, the value of using this with our children as well. So if you have youth in your homes, this is a great tool to kind of help them start to recognize these different things in themselves and have them help too, to give you some clues as to what things they're seeing. And it can make those conversations much easier to approach it in more of a, like, let's fill this out together and talk about both sides of it. As a parent, I know that I exhibit all of these things, and it's important that I recognize that that can impact the kids as much as their behaviors and their emotional health impacts me. If you work with youth, this is a great tool. We work with youth. We've used it with middle and high school students a number of times, and it always goes over really, really well. And they're very open to talking about these things if they have that space to do so. So please use this far and wide with any people in your life, and keep working on it for yourselves as well. So I'm going to hand it back over to Marissa to kind of now talk about some of the things we can do in order to move back into those yellow and green areas.
Yes, we don't want to leave you with just sort of like, well, sometimes I'm in these terrible places. So some reminders, and again, as with the grid, these are things that we think of we can think of for ourselves as professionals, for ourselves within our non-work life, and for the folks that we work with in our roles. So one of the things that we like to do is, someone had just, I think it was Debbie, maybe had just talked about kind of having some of this information visually can be really helpful. And so one of the things we like to do is talk about a couple of these, fairly concrete ways to support emotional health, but that are going to look a little bit different for each person. Like you in a category, you are going to put something different than the person next to you. And then we, if we were, spending 3 hours together and we had a bunch of crafting supplies, we would make an actual emotional health board that would be something that you could keep, on your desk, on your bathroom mirror, right? Like somewhere where are those places where it's helpful to have that reminder of those things you can do for yourself and those resources you have. We're not going to do that today, but we are going to at least have you think about what you could put in that list. And if you are feeling like an emotional health crafting session a little bit later on, we'll show you an example of what it could look like, and that might be helpful. So one of the things that we'd like to think about is really making sure when we're not in that crisis, when we're not in that red zone, is that we know who our supports are. We identify them when we're feeling calm, right? So one of the things we've done, and some of you may have done this, especially if you work with any kind of crisis intervention or work with peer groups that support each other, you might be familiar with a version of the handful of help. So what we like to think of is 5 different categories, and so that's why it's helpful to use a hand analogy, and just kind of that like visual of like some folks that got your back. So, so you can use a few different categories, especially if you're using this in the workplace. There may be categories that are more appropriate or less appropriate for the folks you work with. But for adult professionals, we usually think about these 5 categories. And I would definitely encourage you to kind of like think about it now. And if you want to jot down a note for these different categories, we recommend it. So think about kind of one person for each of these categories. It doesn't have to be the only person, but who would you put in each of these fingers? And we'll send this graphic to you as well. So someone, again, here you can see starting the thumb. So someone in your family, hopefully someone that like is either in your home or is someone you could see fairly easily. So maybe they're not in your home, but you have a parent or a sibling who lives across town. Someone you can really kind of see or get to that's in your family. Then that index finger would be your friend, a friend or a coworker. So someone that's not related to you, but is someone you could reach out to. Sometimes that there's stuff going on that you could really use the support of someone who is not part of the issue, right? So it isn't someone in your workplace. We get to that third finger, and we really want to think about someone who lives at least an hour away. Like they're definitely not in your workplace. They're definitely not someone who's going to be involved necessarily in the particular stressor that you're associated, that you're going through at that moment. So you have someone on that list who's a support, who's going to have that step back. So then the fourth one we like to have people think about is what's a community support that you have. So someone coming back geographically to your community, who is a group or an individual that's a real resource that's close by. So for, it might be a spiritual community, it might be a social group, for folks who might be, like a member in like a veterans group or Elks or Rotary or, some of the different, social and community groups that could exist. It could be a support group, it could be folks, AA, NA, other kinds of mutual support, 12-step groups or things like that, or a therapist or a religious leader. So you kind of get that idea. And then, kind of taking that big wide angle, thinking about what are some national hotlines or support groups, kind of some of those national resources that you might have. That might be a little specific to, an issue that that comes up for you, or it could be something that's just kind of in general, like something that's a national resource for your profession, right? So it could be something that maybe is like a licensing board that has an ethics and support, division or something like that. Like it could be something that's a professional support or something that's more geared towards like a suicide hotline or some national resources around substance use disorders, right? So whatever that might be. So kind of having these things written down and in a place where you can see it or find it again, like, so maybe that's your desk drawer, maybe that's a mirror, maybe that's in like you find it every Christmas when you unpack your decorations. I don't know, somewhere that you're gonna stumble across it, so that you can absolutely see it is going to be important, so that when you are maybe moving more into that yellow or red zone, you have that concrete reminder that there are people out there and organizations out there that care about you and want to make sure that you're getting the support that you need and are those resources. So that's one particular thing. In the interest of time, I will hustle through some other particular things. So again, that was number one. Who are your supports? Who's in that handful of help? So then like stress management, like what are those things? You have a stressful thing. What are those things that reduce stress for you? Maybe it's working out. Maybe it is going for a long walk in nature. Maybe it's reading a book that you love to read, right? So kind of that's gonna be, again, individual to you, but how are those things? What do you know when you have a very acute stressor? What do you know just kind of like lowers that blood pressure for you? Like really kind of takes that, takes you out of that stressful situation and really helps kind of, get those physiological calming things happening. And number 3 is going to be, endorphins. Yes, Macy. Yes. It's very important to figure out what's gonna bring that to us. And then what do you do for your mind-body connection, right? Again, that's going to look a little bit different. Some of them might be similar. Some of them might be, again, they might be working out. They might be doing yoga or doing some kind of centering activities, breathing activities, things that you do to kind of connect where your health is in your mind to where your health is in your body. It's going to look a little bit different for everyone. Number 4 is, how do we find quality time with ourselves? So that is going to be kind of thinking, where are the ways and where are the places in our day that we can get a little bit of that quality time? And maybe it's at the end of the week, maybe it's something on the weekend, maybe it's 10 minutes in between a couple meetings that you're going to, and you get to do something that is just you and is not, does not involve others. Depending on where you get your energy, right? Whether you're an introvert or an extrovert, a little bit of both, you might need more or less time of that. So everyone's going to need some time of quality time with yourself, depending on where you get your energy and where you charge up. You may need less or more of that, but making sure that you know kind of what are those things. And if it's hard to be with just you, that might mean that some of these supports are going to be a little bit more necessary. So that is definitely, I once was at a point in life, personal story here, that like basically if I tried to like sit and just like be without any kind of like, reading or, doing something active, I would like immediately fall asleep. And I was like, okay, that's probably not great for the emotional or physical health piece of this, right? Like, I was like, I don't seem to want to like sit with my existence. And also I am clearly not getting enough sleep. So sometimes, you kind of try some of these things out and realize like, oh, maybe there's a little bit more work that needs to happen. And that's a good thing to learn as well. Number 5, going back to like, do you get help when you need to? We are all at various places of comfort levels of asking for help, right? And whether it's kind of formal help or informal help. So sometimes that's kind of a question we ask ourselves. Am I comfortable reaching out when I need to? Am I comfortable reaching out in the workplace? Maybe I'm comfortable reaching out at home, but at like in a school setting or educational setting, I'm not as comfortable, right? So then maybe it's a little bit of kind of self-inventory on that. And then figuring out, okay, what would help me feel more comfortable accessing help in these various situations, and kind of doing a little bit of work on that. And then life balance. What does that work, school, life balance look like for you? I've heard people use more like some more general terms that don't involve really things evening out, sort of like the work-life relationship, to kind of acknowledge that it's possible that we're not ever going to be in exact balance, but are we getting what we need, and are we able to devote the time and energy to both things in the way that we want to, and that avoids that burnout piece, right? So that's really what we're looking for. In our last moments together, I'd love to show you an example of an emotional health board. Here's how you might envision kind of these things together. So this is one thing that one of our staff members had put together. So they wrote out things that were related to each of those 6 categories, and then found some visuals and some pictures that represented some of these different things. So there was definitely, some of the overlap, right? So in life balance, it referred back to some of the supports. So it's not that these are 6 always like mutually exclusive categories, but just again, another chance, as Debbie said, such a visual learner, right? Like it's so good to kind of have these reminders, and also like it can be fun to make a collage. So that's good.
One of them you're saying like asking for help. It's bringing that up. I had my yearly physical this morning with my doctor, and I told her that. I said I have a really hard time, when I'm struggling, asking for help.
Yeah.
And so it's a good reminder.
Yeah. Thank you for that. It's and such, again, like, so many of us here are in, like various professions where we are helping others as a big part of our professional lives. And that can often, ironically, of course, make it, sometimes it's the hardest for us to ask for help. It's because we are so often in that role of providing assistance. So thank you so much for bringing that up. So this is sort of a super quick, we'd love to think if you want to just, as we're transitioning out, maybe pop one thing in the chat or say one thing that's maybe something that an idea or an activity that you liked from the session or something you'll take with you. if you want to pop, something you're going to take outside. So a thought or an activity that you want to take out to the Zoom door with you that we talked about or that you talked about in your breakout room. And then I think with that, as you're typing those in or saying those, we'll turn it over to our lovely hosts. And if there's anything we need to know to transition out.
Thank you so much. We're gonna actually, as soon as we end this, we're gonna open up our final closing presentation, which starts at 11:45. I appreciate everyone bearing with us. This was an excellent presentation. As far as what I would like to do with this information, I would love to connect you with Government Health Alliance. The tools that you presented in this presentation seem like something they would really like.
Great.
Moving forward with some of their work. They're easy, any easy accessible tools that really anyone can use across different ages and populations. So it's something that a business can do. It's something that can be offered to schools. It's something that we could offer healthcare workers. So I think it might be a great tool for us to help spread around and promote in our community.
That's awesome.
I'm going to put our email addresses in the chat as well. We can also be found online. So please, if you have any questions or would like to talk more about the services we offer, we are available for all over New Hampshire and New England, really. Go to other organizations outside of New Hampshire.
Awesome. Thank you so much. So either you would need to make me host again, or if you just want to end the session yourself, it's totally up to you.
All right. I will stop recording. That recorded to the cloud.
Great.
Awesome.